If you're over 60, one seemingly harmless habit could unexpectedly increase your risk of having a stroke while you sleep. This happens silently, without pain or any warning signs. One moment you feel fine, and the next you might find it difficult to lift your arm, start slurring your words, or lose your balance. It was a stroke. In just one night, tests revealed that he had too much calcium in his blood, his blood vessels had become stiff, and his blood pressure was all over the place. This was all due to an overdose of vitamin D. When calcium is taken in large doses without medical supervision, it begins to accumulate in the blood, and the body struggles to manage this excess. As a result, calcium deposits in the walls of blood vessels, causing them to become rigid and narrow. This is dangerous. If a blood clot forms, it can travel to the brain. As we age, our blood vessels naturally lose elasticity. When you add dehydration, poor sleep, and a sudden spike in calcium levels to the mix, the risk of a stroke becomes particularly high. The most unsettling part: there may be no warning signs at all. You fall asleep as usual, but when you wake up, everything feels different. Here's what you need to know. Many vitamin D supplements sold over the counter in the U.S. contain much higher doses than what older adults actually need, often around 5,000 to even 10,000 international units. People take them daily, thinking that more is better. However, studies suggest that even 2,000 units per day might be excessive if you're not deficient. Let me be clear. If you're taking vitamin D, especially in conjunction with calcium or heart medications, it's crucial to monitor your blood levels and take it in the morning rather than at night. Do you know how many units are in your supplement? Comment with the letter D if you're currently taking vitamin D. And let's discuss it. If this information made you think, please give it a like so more people can see it. Now, here's an important point. There's a vitamin that is often taken for heart support, but for older adults, it might be more dangerous than it seems. We're talking about vitamin E. Many believe that vitamin E is good for the heart. If you've been taking it for a long time, you're not alone. Many people over 60 add it to their diet in hopes of improving heart function, circulation, and sometimes even memory or skin condition. But there's an important detail that is rarely discussed. An excessive amount of vitamin E, especially if you're on heart medications, can increase the risk of a brain hemorrhage. This can happen even to those who are very health conscious. Let me share a story that I will never forget. Mrs. Emily Johnson, 81, used to work as a librarian in Florida. She was known for her intelligence, great sense of humor, and she almost always had a book in hand. Emily had heart issues, so she was taking warfarin, a medication that thins the blood. The doctors were closely monitoring her condition. Her tests were fine, and her blood pressure was stable. One day, she came across an ad for vitamin E in a magazine and decided to buy a bottle that contained 800 IU per capsule. "I thought it would help improve my memory and circulation," she told me. As a neurologist, I encounter such cases among elderly patients all too often. And the cause isn't always related to smoking, poor diet, or lack of exercise. Sometimes the issue lies with something that seems beneficial. 3 weeks later, Evelyn was rushed to the hospital. She was experiencing a severe headache, felt confused, and was nauseous. A brain scan revealed that she had a hemorrhagic stroke, meaning there was bleeding in the brain. The cause wasn't a spike in blood pressure or an injury, but rather the combination of warfarin and high doses of vitamin E that had overly thin her blood. One of the vessels turned out to be weak and couldn't withstand the pressure. Not many people consider this. In high doses, vitamin E acts as a natural anticoagulant, meaning it slows down blood clotting. If someone is already taking blood-thinning medications, such as aspirin or Plavix, and then starts taking vitamin E as well, the risk of internal bleeding significantly increases. This is especially dangerous for the brain. Even a small hemorrhage can lead to loss of speech, memory, or motor skills. For elderly individuals, the recommended daily dose of vitamin E is only 15 milligrams, which is about 22 IU. However, most supplements on store shelves contain 200, 400, and even 1,000 IU in a single capsule. There are almost no warnings on the packaging, and people often take these doses for years without consulting a doctor. Mrs. Jessica is still alive, but she now has to rely on a cane. Unfortunately, her memory has not fully recovered. She shared this with me, tears in her eyes. She said she was just trying to help herself and didn't realize it could cause harm. It's really hard to hear, especially since she's not the only one. Many older adults believe that if something is called a vitamin, it must be completely safe. However, this isn't always the case, especially if you're taking medication for heart conditions or blood pressure. Before starting any new supplement, it's essential to consult with your doctor. If you think a stroke is the worst thing that can happen, there's another vitamin that people often take for nerve health and energy boosts, but it can secretly cause harm, sometimes permanently. We're talking about vitamin B6. It's frequently marketed as a supporter of the nervous system and cognitive function. You've probably come across bottles in pharmacies with labels promising increased energy, improved memory and focus, and support for tired nerves. Perhaps someone you know has recommended them to their parents or elderly relatives to help them feel more energized. However, what is rarely mentioned is that excessive intake of vitamin B6 can actually damage nerves, and sometimes these changes can become irreversible. Let me tell you about a patient named Michael Johnson, a 76-year-old former truck driver from Texas. He came to me complaining of numbness in his feet, tingling in his hands, and balance issues. At first, he thought it was just a result of aging. Then he started to fall. At first, just once, then again. The third time, he hit his head hard on the bathroom tiles, in vitamins. Yes, that's exactly what I'm talking about. Every day, millions of elderly people take various supplements to support their bones, boost energy, or maintain mental clarity. I checked the supplements he was taking and quickly realized what was going on. He had been taking vitamins for nerve support for over a year. The label claimed they were good for the brain and improved circulation. Each tablet contained 100 milligrams of vitamin B6, and John was taking 2 tablets a day. That adds up to 200 milligrams daily, which is 10 times the safe upper limit for older adults. But then things get even more concerning. Unlike some vitamins that are quickly expelled from the body, vitamin B6 can accumulate over time. In older adults, this can sometimes lead to damage to the protective sheath of nerve fibers, similar to removing insulation from a wire. This can result in symptoms like tingling, numbness, muscle weakness, tremors, and sometimes even confusion or memory problems. The most concerning aspect is that these symptoms develop slowly, and many people mistake them for normal age-related changes, arthritis, or even the onset of dementia. In reality, the cause could be an excess of vitamin B6. This is a rare but entirely preventable issue of nerve damage caused by a supplement that was supposed to provide benefits. If not detected and addressed in time, the consequences can become irreversible. Mr. Smith was fortunate. We discontinued the supplement in time, and the situation did not worsen, although he still needs to use a cane and no longer drives. He told me, "I just wanted to protect my brain." I didn't realize that I was actually harming him. Let's clarify. Vitamin B6 is indeed essential for the body, but only in very small doses. For elderly individuals, for example, a mere 210 milligrams a day is sufficient, and that's already considering what they get from their diet. However, many brain support supplements that are easily found online and in pharmacies contain 50, 100, or even 200 milligrams in a single serving. This isn't just excessive, it can be dangerous. If you're taking supplements labeled for nerves, brain support, or energy, make sure to check how much B6 they contain. It's best to know the exact numbers to avoid harming yourself. If you've had experiences with such supplements or know someone who has, feel free to share your story. You might be wondering, what about other vitamins? For instance, can vitamin A really be dangerous? Many people believe that vitamin A is only necessary for vision, but that's not entirely true. Let's take a closer look at what we know about this vitamin. If you're over 60, chances are you've heard that this vitamin is good for your eyes, supports your immune system, and benefits your skin. It's even said to help slow down the aging process. You might have taken it on the advice of friends or doctors. Many of these supplements do provide benefits, but some vitamins, especially when taken in high doses or at the wrong times, can silently harm the brain. Today, I'll discuss 5 vitamins that can increase the risk of stroke, bleeding, or sudden spikes in blood pressure, particularly in the early morning when the brain is most vulnerable. If you've ever taken vitamins D, E, B6, A, or niacin, this information could be very important for you. However, there's something that is often overlooked, especially for older adults. As we age, vitamin A doesn't just get used up by the body, it can actually accumulate. Excess vitamin A doesn't just disappear and can lead to serious problems. Over time, this can result in increased pressure within the skull. Symptoms may mimic a stroke, vision can deteriorate, and brain function may be impaired. To clarify, let me share the story of Miss Emily Johnson. She was 79 years old, retired, and used to teach children how to play the piano in Florida. Music was her passion. She welcomed students into her home and greatly valued her independence. But one day, she started experiencing headaches. Then her vision became blurry. She felt weak. Dizziness set in, and her speech became slurred. Her family became worried that it could be a stroke. But when we conducted the examination, everything turned out differently. We found neither a blood clot nor any hemorrhaging. The issue was something else entirely. She had excessively high intracranial pressure. Cerebrospinal fluid began to accumulate, and the small blood vessels in her brain were under strain. The cause was vitamin A toxicity. For over 5 years, she had been taking a skin and eye supplement at a fairly high dose, almost 10,000 IU daily, without any awareness of the potential consequences. Vitamin A is unique among many other vitamins because it is fat-soluble. This means that the body does not expel it immediately, like it does with vitamin C or the B vitamins. Instead, It accumulates in the liver, tissues, and even the brain. As we age, the liver tends to function more slowly, causing excess vitamin A to build up even faster. If too much vitamin A accumulates, it can lead to a condition known as a pseudotumor of the brain, which presents symptoms such as headaches, blurred vision, double vision, dizziness, nausea, and in severe cases, even deterioration of vision or cognitive abilities. The issue is that many multivitamins already contain the daily recommended amount of vitamin A, but people, like Mrs. Smith, often don't realize they are exceeding this dosage by also taking additional supplements for skin, eye health, or anti-aging. A safe dose for older adults is considered to be around 2,500 to 3,000 IU per day, and only if necessary and under a doctor's supervision. But on the internet, it's easy to find supplements that contain much higher doses of vitamin A, 5,000, 10,000 IU, and even more. Taking such supplements daily for months or years can lead to cumulative harm to the body that goes almost unnoticed. Right now, Mrs. Johnson is gradually recovering. She now needs regular eye exams, pressure checks, and special treatment to regain balance. She confessed to me, "I thought I was only doing good for myself. I couldn't even imagine that it could harm my brain." I'm sharing this story not to scare anyone, but to ensure you have all the information you need to protect yourself. If you thought that vitamins for eye health could be dangerous, just wait until you hear what can happen when a vitamin that's supposed to lower cholesterol and support heart health suddenly causes high blood pressure. Let's talk about niacin, also known as vitamin B3. Have you ever considered that vitamins can not only be beneficial, but also harmful? If you'd like to learn more, leave a comment with a 1 or a 0 if this is the first time you're hearing about it. If brain health is important to you or your loved ones, please support the video with a like and subscribe to the channel. You may have already heard that it's recommended for heart support or lowering cholesterol. Some doctors actually advise their patients to take it. Niacin is often included in heart vitamins, energy drinks, and even some types of cereals. However, there's an important point that isn't always discussed, especially when it comes to elderly individuals. Taking niacin in large doses can silently cause serious blood pressure spikes and even lead to a stroke. One of my patients, Mr. John Smith, is 82 years old. He lives in New York, is retired, and used to work as a mailman. He came to me with some unusual complaints. In the mornings, he experienced hot flashes, felt strong heart palpitations, and occasionally had dizziness. His wife thought it was just nerves. His son thought that the high blood pressure medications were to blame, but the real cause was something completely different that no one even suspected. Kevin was taking an over-the-counter heart supplement that promised to support cholesterol and circulation on one side. But in fine print, it noted that each serving contained 1,000 units of niacin. He was taking it twice a day, meaning he was getting 2,000 units daily, which is more than 60 times the recommended amount for most elderly people. At such high doses, niacin initially dilates blood vessels, which can cause the face to flush or feel warm. However, the blood vessels then constrict sharply. This sudden change can increase blood pressure, put strain on the heart, and reduce blood flow to the brain. Over time, the yo-yo effect takes a toll on the body, like a hammer on fragile glass. Sooner or later, something is bound to crack. David experienced a mini-stroke. For a few minutes, he lost his ability to speak normally, but then it passed. He decided it was just a fluke. But I had to break the unpleasant truth to him. The supplement he was taking for his heart was quietly harming his brain. And David is far from alone. Many older adults are taking high doses of niacin without even realizing it. They order niacin without flush effects or in slow-release forms online, believing these options to be safer. However, even these forms can raise blood pressure, cause arrhythmias, and affect blood sugar levels. It's important to remember that older adults should not take more than 50 milligrams of niacin per day without medical supervision. If you have high blood pressure, heart issues, or are taking medications, be sure to pay attention to the ingredients in supplements. David no longer takes niacin, and he is gradually recovering. There are no serious side effects remaining, but he told me one thing that stayed with me. "Doctor, I thought I was doing everything right. I didn't know I was risking my brain." We've already discussed 5 popular vitamins that can subtly harm the brain. Here, we provide honest and straightforward information, especially for those who care about their health in later years. Let's start with vitamin D, something that not many people know about. It's often recommended for strong bones, good mood, and immune support. Now you might be wondering which supplements are actually worth taking. Or perhaps it's even better to focus on what to simply add to your diet. Let's talk about real food, the kind that truly cares for your brain and carries no risks. You might be wondering, if vitamins can be dangerous, what should we do? That's a valid concern. Our bodies aren't designed to get everything we need from pills. We are meant to consume simple, natural, and wholesome foods, specifically those that our brains can easily process and utilize. Let me tell you about Mrs. Margaret Johnson. She's 73 years old and used to be a school principal in Texas. When we first met, she showed me an entire box of supplements: vitamin D for bones, vitamin E for heart health, B vitamins for energy, niacin for cholesterol, multivitamins, and a few other brain support products. "I'm doing everything right, doctor," she said. She had been experiencing dizziness in the mornings and constantly felt off balance. Her blood pressure kept rising, and we couldn't figure out why. So we decided to try something completely different. We started eliminating everything unnecessary. Gradually, we phased out medications and focused on food instead. No trendy diets or complicated schemes, just simple, natural foods consumed at the right time and in the right combinations. For example, for breakfast, she had 1 hard-boiled egg, a great source of protein, half an avocado, packed with healthy fats, a slice of whole-grain toast for sustained energy, and a handful of blueberries, known for their brain-protective benefits. She also drank a glass of room-temperature water to wake up her mind. Sometimes she added a couple of walnuts or a bit of almond. And that was it. No powders, no pills, just straightforward, wholesome food. Within a couple of weeks, Emily noticed changes. Her dizziness faded, her blood pressure normalized, and she felt a surge of energy. She confessed to me that her thoughts have become clearer than ever in recent years. That's why it helps. For the brain to function well, it needs water, healthy fats, a steady supply of energy, and vitamins from everyday foods. It's not about chasing after huge doses. Maintaining balance is key. Leafy vegetables like spinach and kale are especially beneficial for older adults, as they are rich in folic acid and antioxidants. Fatty fish, such as salmon or sardines, are high in omega-3 fatty acids, which help protect brain cells. Berries contain polyphenols, which help fight inflammation. Nuts and seeds are a source of vitamin E, magnesium, and healthy fats. Whole grains support normal blood sugar levels and improve circulation. It's all true, but only if you don't go overboard with the dosage. Many older adults don't realize that too much vitamin D, especially if taken before bedtime, can subtly increase the risk of stroke. I know it sounds surprising, but I've encountered such cases among my patients. All of this is important not only for the brain. These foods are beneficial for the heart, bones, mood, and mobility. Every meal is an investment in your health. Most importantly, it's essential to pay more attention to yourself and your habits. At this age, every choice you make carries special significance. It's not just about the supplements themselves, but rather how well you understand their effects on your body. By the time you're 60, 70, or 80, your body processes these additions differently than it did before. Even the habit of taking vitamins, which seems beneficial, can have unintended consequences if you're not careful. Mindfulness is your best ally. There's no need to fear vitamins, but it's essential to approach them with caution. Read the labels, consult with your doctor, and pay attention to how your body reacts, even to subtle changes. If something in this video resonated with you, please share your experience in the comments. What small change are you willing to try starting tomorrow? If this helped you, please give it a thumbs up so more people can see this video. Subscribe so we can learn new things together, grow, and become stronger. You're not alone, and it's never too late to start taking care of your health. For example, I had a patient named Mr. James, a 74-year-old retired sailor. He was a very smart, disciplined man who paid close attention to his health. Every morning, like clockwork, he took his supplements, including a 10,000 IU vitamin D capsule that he purchased on his own. He was convinced that it would help strengthen his bones. Little did he know that this seemingly harmless habit was slowly leading his body to serious problems. One morning, his wife found him in a daze. He could barely speak, and his right arm was hanging limply.